مساء الخير مشاهدينا ومشاهدين قناة المحور، أهلا وسهلا بيكم ويوم جديد وحلقة جديدة من برنامج الطبيب. فقرتنا دلوقتي فقرة مهمة جدا جدا ومختلفة تماما، لأن موضوع فقرتنا هيكون عن صحة أسنان أطفالنا. أمهات كتيرة جدا بتبعت لنا على صفحتنا صفحة الطبيب على الفيسبوك، وعندهم تساؤلات كتيرة جدا عن صحة أسنان أطفالهم، خصوصا لو الأطفال في سن صغير ولسه بيكونوا الأسنان اللبنية، ولا قدر الله يحصل مثلا تآكل أو تسوس. علاج الحاجات دي بياخد وقت وبيبقى صعب شوية، عشان كده احنا النهارده مخصصين فقره كامله مع ضيفه مهمه جدا جدا، دكتور جورجيا رالوكا، اخصائي وتجميل زراعه الاسنان جامعه بوخارست رومانيا. First off, doctor, I would like to say that it's my absolute pleasure to have you here on the show with us to gain more knowledge from such a great doctor such as yourself. Thank you for being here.
Thank you so much for having me here.
Thank you. Doctor, we have to start by saying that maybe here in Egypt we don't have the concept of maintenance. We don't know, or we don't have the know-how of when to take our child to the dentist. When do you think it's the appropriate age to do so?
We have to take an appointment with the dentist starting with the eruption of the first tooth, and not later than the first birthday, in order to prevent any risk for possible decays.
All right. What about if she's pregnant, like the woman is pregnant and she's trying to go through the whole knowledge of how to take care of her kid? When is it appropriate to start learning about these things?
The pregnant lady, when should come to the dental office.
Yeah.
The pregnant lady, it's better to, if she has a pregnancy that she planned, she is supposed to come before the planned pregnancy, in order to take all the possible X-ray that she needs, and to prevent all the decays and the root canal and such stuff to the dental office. But if she's not, it's not possible to do that, it's okay to come at the dental office during pregnancy, and we recommend to do it every 3 months, a checkup. Compared with
that's the normal, like every 3 months.
Every 3 months, because of the hormonal imbalance and increased blood flow on the mouth and gingiva, are some changes during the pregnancy that we have to control.
Speaking of hormonal changes, doctor, we have a lot of women here who fear the whole X-ray thing. They don't want to go there. They think there is some sort of consequences regarding this issue. Do you think it's safe or not?
It is safe to take a dental X-ray, because it's considered that the 10 rad, which the rad, it is the measurement for the absorption X-ray, can affect the baby, producing some mental retardation or eye abnormalities. But the dental X-ray will never exceed more than 5 rads. For example, a single dental X-ray can give a 0.01 rad, millirad. Considering that 1 rad, it has 1,000 millirads, it takes like 100,000 X-rays in order to that the baby can be affected by a single rad. To put this in perspective, during the normal course of pregnancy, you and your baby will receive about 90 to 100 millirads from the normal environment, from the sun and the earth.
This with this situation,
so during a single X-ray, it will be equivalent to stay outside for a single day, to spend a day outside under the sun. Even so, we prefer to postpone any unnecessary X-ray, but if it's a must, we have to be sure of proper shielding, and the pregnant lady should be comfortable that will be no risk for her baby.
What if the whole genetics thing in the family, that something is wrong in the history of the family when it comes to dental care? Any pregnant woman should take some course of precautions or something regarding her baby throughout the pregnancy, or not?
This she has to arrange it with her doctor, with her obstetrician doctor. But regarding my specialty, we have to be careful on bacteria amount in the mouth during the pregnancy, because this, due to the hormonal imbalance, can create a big problem. The hormonal imbalance during the pregnancy make us to receive over 50% of the pregnant ladies to the dental offices during this time, and this can affect the can produce a gum disease. The gum disease in the mildest form, it is known as gingivitis, which is characterized by gum swelling, bleeding, or discomfort.
All right.
Left untreated, it can create a periodontal disease, which is an inflammation, chronic, and an infection as well of the gum and the surrounding support structures of the teeth. This can create a tooth loss, weak jawbone, a tooth loss as well, weak bone, and other deformities, among other problems, irreversible. The surplus of bacteria, because of the blood increased blood flow, can travel through bloodstream into placenta and amniotic fluid.
All right.
And can affect the growing baby, creating infection or an immune response.
What kind of infection?
Different infections can happen, and this can lead to miscarriage or low baby weight or a premature birth.
Okay.
That's why we have to understand that preventing any gum disease, it's actually meaning taking care of a baby.
A lot of women actually, Dr. Georgia, worry about the whole part of dental anesthetic. Is it safe during pregnancy or not?
Our safe dental anesthetic that we can recommend during the pregnancy, like lidocaine and other substances that we can use. And we have to think that the dental lady will come in case of emergency. So an inflammation and an infection on her tooth, it's supposed to take an painkiller or antibiotics. Painkillers are contraindicated during pregnancy, and antibiotic is better to reduce the amount of it during this time. So putting in balance the benefits and the risk, taking an anesthetic, it is easy and the best way possible in this situation. Will relieve the pain, will remove the infection and the inflammation.
But there is no risk for it? There is no consequences for it?
No, it will be not risk. In addition to this, at our clinic, it is also a laser dentistry office that doesn't require anesthesia, so we can manage the situation in a better way.
A lot of women actually ask right now, what kind of dental work is it safe during pregnancy for herself, not the baby?
During pregnancy, we have to limit X-rays as much as we can. But other way we can do any other thing like root canal treatment, it's okay, cavity fillings or crowns. But we prefer to do this in the second trimester because we don't like to make the pregnant lady to feel uncomfortable for a long period of time on the dental unit.
What about the first checkup for our child? Like a lot of women ask, when is it the appropriate time to take my child first time to the dentist?
Like I said, starting with the first tooth, eruption of the first tooth, we have to address to the dentist, and no later than the first birthday.
All right.
Other way, we have to take care of the proper way of brushing and flossing. They have to start flossing as soon as two teeth are in contact with each other, so very early.
A lot of women also says that, okay, my baby is scared to actually, my child is scared to go to the dentist. It's a scary experience. I don't want to go through this, so let's just dodge the whole thing. How can I encourage my child to be like, yeah, it's okay, it's just a doctor, there is nothing to be scared about? How can I do that?
At our clinic now we have the laser dentistry, like I said, and water laser is #1 in pediatric laser dentistry and in pediatric care in this field. And except that is no shots, no drill, no anything to the baby to be scared of. It is ideal treatment for baby because the mothers and the baby love no drill, no shot dentistry.
Yes.
As all of us actually.
Yeah, it's just a scary experience for the all of us.
Yeah, and
it's just the pain. It's the pain factor that we fear the most.
It is the pain factor, and it's the anxiety that we created to ourselves before
panic attacks and stuff.
Exactly.
We want to know how important the baby teeth for our children.
Baby teeth are very important for our children, not only for helping them to chew properly or to talk clearly and smiling, but they are very important to create a path for the permanent teeth in order to erupt in the right position.
Okay.
That's why we recommend space maintainer if in case of extraction of a baby tooth before the time. We recommend a space maintainer to keep the space for the permanent tooth to erupt.
Great. Moms and mothers, they just send a lot of questions regarding thumb sucking and pacifier habits. They want to know, is it harmful for the children's teeth or not?
Usually these habits, the baby, they stop it on their own.
Okay.
But if they prolong by the age of 3, you can ask your pediatric dentist about mouth appliance.
Okay. And how can we prevent the decay, caused by nursery?
We have to start preventing the bottle decay and nursing the decay at soon after birth.
Okay.
By cleaning the baby gums with a soft gauze or a washcloth after every feeding.
All right, that's it.
And we have to don't put anything else than water in their bedtime bottle. To stop giving them any sweetened things like.
It's gonna be hard, doctor. This is gonna be terrific.
And when we will start to give them the food, normal food, I prefer to give them juices, fruit juices.
Okay.
Diluted with water in proportion of 1 to 3 from the sipping cup instead of the feeding bottle.
All right.
Later on, when the teeth erupt, we have to brush their teeth with an infant toothbrush. At the beginning without toothpaste. And after the age of 2, when the baby can spit out the remaining toothpaste, we can use a small layer on the toothbrush of
just a small layer. You don't have to go big.
Of unfluoride toothpaste, and the gums that don't have yet the teeth on it, we clean it with a gauze, as I said before. Between the age of 3 to 6, the toothpaste amount can be increased to a pea size. And we have to supervise their brushing because at this young age they are not able to brush effectively. That's why we recommend an electric toothbrush to help them to clean.
It's safe, the electric toothbrush.
It is safe, and it's designed for them. They have very small toothbrushes for their age and their mouth.
Great. What about if I'm trying to maintain a healthy diet for my child, for his teeth's health? How can I maintain that, and what components should I put in the meal?
We have to be sure that the baby has a balanced diet consisting in at least 1 serving per day of fruits and vegetables, of cereals and breads, and fish, eggs and meat, limiting the sugars and the starches. And as I said, I prefer the baby to start to eat vegetables instead of fruits, even if it is recommended. I'm sorry.
Why?
Because the baby gets used with a sweet taste.
Okay.
So this will create a problem
to
later on to receive the vegetables.
Of course.
So if we start like this with the juices, just dilute it and clean their gums after eating, and not let it in the bottle at the bedtime.
Of course. Doctor, we need to ask about the decay preventive techniques that can be done in the office or the dental office. What kind of techniques that are available right now?
Now we can do pit and sealant fissure of the permanent molars that can prevent the decays in a very good way. Sealants are just applying on the crevices of the chewing surfaces of the molars, and this ensure a very safe lifetime of the tooth for a long time. Also, we can do varnish, fluoride varnish for the children that they have a medium risk of decay every 6 months or every 3 months for highly risk. And we can do decay assessment in our office as well, teaching the children how to brush their teeth, and also offering diet counseling advices.
When is the counseling, when it's the recommended times of visiting per year for a child?
For a child, it's okay to come every 6 months.
Everything, just to check on everything that is good?
Just a check, and the child, if it's no problem, he can get used with the dentist, he can play a little bit. We can interact very nice, so he will the anxiety will be limited later on, and we will prevent also the decays.
Of course. Can you tell us more about the most common problems that you face at the clinic when it comes regarding children?
When it comes regarding children, it is a little bit difficult if they come with major problems, like nursing bottle decays, which produce disasters at very early ages, when will be difficult to make comfortable the child on the chair, and this includes a lot of work. It is frightening to hear the drill, and they have to support also the anesthesia, which is the shot. It's scary.
Yes, of course it is. It's just a scary experience.
So this is the main problem regarding the new materials and things that appear for the children in case of decays, big decays. For the teeth that are weakened and they cannot be filled just with material. Nowadays, instead of the stainless crown that we used to do it, we use zirconia-like crown, which looks like a natural tooth, especially for the frontal teeth, and will reduce the bad taste in the mouth that the other one will produce as well.
Great.
So this is a new way and a better way to save their teeth for a longer period.
Of course. Also, we need to know, like a lot of mothers ask, how can I just protect my son's teeth during sports events?
We can do a soft mouth guard.
Okay.
That
can you just tell people more about what is a mouth guard?
A mouth guard, it's protecting their teeth during sports events.
Yeah.
Exactly, protecting not only the teeth but the gums, the cheeks, the joint, and even the head.
Okay.
Yeah, so it is an easy way to do it.
That's the only procedure that we can do. That's the
yeah, it's very easy. They just come to the office and we take an impression and we do this. It's very easy.
But what about if one of our sons just fell off and hurt himself and just knocked down a permanent tooth? That's like a scary nightmare for every mother.
Yeah, it is.
What can they do in that situation?
The first thing to do is to remain calm.
Okay. Yes, please, the first step.
And after that, you have to stop the bleeding.
Okay.
And pressing soft gauze on the injured area. Trying, if the baby it is old enough, he can close his mouth against this gauze, or can press alone pressure on it. If no, the moms or who is around will press pressure on the gauze. At the same time, try to find the tooth, grab it from the crown side rather than the root, put it in the saline solution or in the glass of milk, never in the tap water.
Oh, why?
Because
they always do that. They just put it in the water, the first thing.
No. Because the saline it can keep all the tooth in the safe way. Okay, and yeah.
To what period? Like maybe if it happened in a couple of days, it can stay in the milk, or it will be completely
well, within a few hours.
Few hours.
Yeah.
And that's it.
Yeah, within half an hour to 2 hours, 3 hours, it's okay.
Great.
We can reimplant the tooth after that. Yeah.
Okay, but there's no like substitution for it. The normal one that he lost, he can just replace it back on.
Yeah, if it's the good condition for it and the root it looks properly to be reimplanted, we will do a reimplantation and fixation of the tooth, and we can go on. And
they can heal properly, or there will be problems regarding the child?
No, they can heal properly. That's why it's important to go direct to the dental office.
Great. Doctor, can you tell us more about what's new, what new techniques that we have here regarding the children's field, dental field, and in general, how's their new laser we heard about? We heard about a lot of recent techniques. Can you tell us more about it?
The laser techniques are the best techniques for the children because they are actually kid-friendly, and it is frightening for the child to do all the work with the drill and to take the shot. And in order to do the shot, you have to make comfortable the child, to wait for the anesthetic to work. And after if the child is not bored, you can start working. So in order to prevent all of this, the laser can do the job without the anesthetic and without the scary part.
Okay.
And because of no anesthetic is required, you can do more than to work in more area of the mouth.
On the bigger areas?
Yeah, in different area, because when you do an anesthetic, you prefer to work only in that area, and maybe it's in the opposite or in the upper also, so you can do more things at the same session and in a short period of time.
Great.
And with the laser you can do even palpatomies, which are impossible to be done in the classic dentistry without the use of anesthetic.
Are there specific cases where we can't use the laser for kids, maybe a historic thing in the family, maybe it's genetics, or it can be applied to all cases when it comes to children?
No. Lasers are safe for everybody else as they are for pregnant and for children and for anybody else. This is not a contraindication.
At all?
No.
What about when they grow old a little bit, when they're 10 or 12? How can I, as a mother, take care of my child's teeth? Because a lot of them are quite stubborn, like children. I don't want to brush my teeth, I don't want to do this. How can I maintain the habit?
If it starts at early ages, this is turns into a habit.
Okay.
So it will be easy for them to do this every day, every evening, every morning. They will just do it because it's in their nature.
Yes.
And you have to supervise them.
All right.
And if they don't like, if they are tired, you have to insist a little bit. Because if it's skipping
a habit. At the end of the day, it's a habit.
If it's skipping a day without brushing, maybe tomorrow will be the same.
What about flossing? The same thing, or it's not necessary in young age?
No, flossing is very important.
Okay.
As long as teeth are in contact, you have to do flossing. Don't skip it. It is very important.
We don't have to skip this step, it's important.
No, it is very important, and at least once a day, especially at night, you have to do it.
Sadly, our segment has come to an end. It's my absolute pleasure for me to have you here. Thank you so much for your time.
Thank you so much for having me here. It is an honor to be here.
Thank you. بنشكر دكتور جورجيا رالوكا، اخصائي تجميل وزراعه الاسنان جامعه بوخارست رومانيا. مشاهدينا فقرتنا خلصت، حلقتنا لسه مكمله، فاصل صغير ونرجع لكم، ابقوا معنا.